So you're looking for a better movement screen. What are the things that you need to do if you're a running expert, you're a barbell expert, ultimately you're a cash-based physical therapist who specializes in working with more active people, more athletes, and you're trying to refine what to do inside your sessions to streamline your outcomes. I'm here to share that in this video. My name is Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes, maximize the patient experience, and thrive in business. When you look at movement screens, you have to look at what the purpose is for a movement screen. It's to tell you information on what additional stressor could be contributing to this person's pain. When a cash pay patient comes in to see you, they're ultimately looking for a solution. What is the solution? They want to remove the pain that is blocking them or preventing them from doing insert their favorite activity. So that could be playing softball on the weekends. They're having knee pain every time that they run the bases, or they swing a bat, whatever it may be. That's the thing that's blocking them from. So your job here is to figure out what is contributing to this person's movement that is then forcing them to have pain when they play softball. So when we do a movement screen, you can do specific to their sport. That's completely understandable. That's just the nature of what most people think, that if I work with a tennis athlete, that's going to be very different than somebody who plays bowling, another person who does volleyball. And now those are all very different sports, but ultimately you're trying to figure out, is there an underlying root to why this person is continuing to have pain? So instead of having 50 different movement screens and trying to figure out a specific one for every single patient, you're going to overload yourself. Now, if you're early in your cash-based PT world and you just started your business, of course you're going to go crazy, you're going to go ham and try and customize everything to everyone, because that's what you went into cash for. Let me guess. Personalized one-on-one care with a doctor of physical therapy. That's probably the slogan. That's the thing that gets you over the edge. And now you want to tailor every single exercise to that person and tailor every single movement screen to that person. And then you become more established, and then you realize that was a complete waste of time, but it's what you knew. Why? Because you went from insurance-based care, so you provided the exact opposite: complete freedom and personalization and unlimited time, and you have access to me whenever you want. And then you realize that was not the route to go, and so now you're in this world of, okay, how do I get more efficient at this? How do I provide the same level of experience but not be so templated and rigid as insurance-based, but not all over the place and providing everyone with everything they ever wanted? And now you have no time, and because you're spending all that time creating customization on weekends and nights. But that's the reason why you got into cash, because you didn't want to work extra hours for less money. The irony of this exists. But nonetheless, how do we get into a movement screen that fits a little bit of everyone? And I can tell you, whether that's a runner or a weightlifter or a basketball player, you just have to look at the fundamentals of the basic movements that people complete on a regular basis. So you don't have to do a fancy swing analysis or anything like this. Here's what I can tell you inside any movement screen that you develop. I don't know the population that you work with, but ultimately, here's what I can tell you. Here's a framework. You don't want more than 7 movements. So you're going to have to pick your 7 movements that tell you the most about any individual that comes in. The soccer player who is 16 years old, who's having Achilles issues, the 27-year-old basketball player who enjoys pickup basketball, or the 45-year-old who plays pickleball on the weekends. All of those people have very different movements, but you're looking at what are the 7 movements that all of them share together. So for most people, it might be a squat, it might be a single leg balance, it might be a forward bend, a backward bend, arm raises. And I'm here to tell you that once you establish what your personal movement screen is, you can then refine that. But most people, they fight it. No, Chris, it's custom, it's personal. I have to screen everybody for everything here. The problem is you spend all that time, you don't have enough time to actually solve the person's problem. And because you're looking at the impairments as the main issue, that's the problem in the first place. So a movement screen, what's its place? Just to look at what additional stressors are there. It's not the entire session. Just because you wanted more time on insurance-based doesn't mean that's what the patient wants or needs. You're just doing it because you didn't know any different. You just wanted more time so you can process it. But in reality is, you didn't get efficient at it in the past, and you didn't solve that problem now. So you're trying to figure out that if I screen every movement, that's going to solve it. Well, here's the problem. Once you determine that this person has 57 impairments dealing with their poor movement, which one do you triage? Make it simple in your life. Do 7 movements. figure out your 1 or 2 impairments that you need to address and give those and make sure that that's their homework. So why make it more complex? Make it simple. Why? Because you have to process less, the patient has to process less, and it makes it simple. Anytime that you work with a buyer or a consumer, the buying process, when done simply, allows that buyer to have less friction, less of a barrier to come to see you, or even come back to see you. So if you can make this efficient, make that movement screen so simple that it told you in just enough information that you now can create a simple and basic home program, and that allows them to understand what you're doing. Now, when you make it super complex from a movement screen and you're like, oh, your neck rotation, it just doesn't go to the left 4 degrees. Oh, your big toe doesn't extend 6 degrees. And your left hip, it's just missing a little bit of external rotation. And the consumer's like, oh, that sounds horrible and miserable. What am I doing today? And you're like, well, dead bugs. And you're like, wait, what did those other impairments have to do with that? Oh, nothing, it was just part of the screen. That consumer's so lost. They didn't need to know any of that if you were just gonna give them dead bugs. So if that's the case, why not just do 3 movements that could have came to that same conclusion that only related to dead bugs, that you can continue to reassess, and that patient can see, wow, I'm improving on my insert impairment that is now giving me the dead bug exercise. So your goal here is, what are 1 and 2 impairments that you need to address, all solved with no more than 7 impairments or 7 movement pieces to a screen that you need to do. You can do a single leg lunge, you can do a split squat, you can do a running analysis, you can walk it. You're just trying to simplify this process, because most of the time on that session is on the subjective portion. Understand what they need, what they want, figure that out, go through 7 points of a movement screen, then get them on the table, work your magic, whatever it is that you do, and then give them a simple plan of care. The movement screen is just to help you get to the plan of care faster. And if you think that the movement screen is the art, you're wasting your time. Whether you're a movement specialist and that's the thing that you're branding, you're wasting a lot of time, because ultimately if you make it complex, the consumer can't understand it, the patient is confused. How would they commit to a plan of care when they don't even know why they're doing that? So if you're looking for the perfect movement screen and how to implement this inside your business, make it simple, make it fast, and you should be able to go through that in under 7 minutes, 1 minute per test, and that'll solve your challenge, and you'll have patients who want to come to see you more often with better outcomes and who are ambassadors for everything that you do. So there you have it. That is the best way to structure a movement screen inside your cash-based PT practice. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.